First, as we get older, concerns about arthritis and pain play a role in staying active. You may see a decline in how active you can be because of your joints. So, how do you know when it's time to go see a specialist? To answer that question is Dr. Kevin Bozick. He is an orthopedic surgeon at UT Health Austin. He's going to talk to us about this. Good morning, doctor.
Good morning.
Thank you for joining us. Because there are a lot of people, who have family members who have arthritis or they're experiencing it themselves. How does it work? What's happening in the joints that's causing arthritis?
Sure. So arthritis just simply means deterioration of the cartilage on the ends of the joints, and it's multifactorial. There are genetic causes, there are lifestyle causes, and some of it is just simply due to wear and tear that occurs with aging.
Who's more susceptible, men or women?
It's a good question. It happens in both. It depends on your activity level and other lifestyle factors such as your weight, but both are equally susceptible.
Okay, so less active or more active?
More active, but there are certain types of activities that are more detrimental to the joints, so impact type activities.
I see.
So as we get older, we like to transition people from, let's say, running and jumping type activities to more joint friendly activities like bicycling, walking, swimming, those types of things.
Okay, got it. Okay, so let's say that a person who may be a runner, maybe not an avid runner, but they're starting to feel some pain. When do they come and see a specialist?
Well, it's a good question. So the team that we've developed includes a variety of different people. So it's not just surgeons, for instance, or not just physicians. So on our team, we have physical therapists, we have chiropractors, we actually have a dietitian on our team. So we have people that really try to understand what's causing this condition, and then we have a variety of different ways to treat it. And so I think that as soon as you start experiencing pain that impacts your lifestyle and your activities, that's the time to seek out treatment.
Okay, because that was my next question, which is that some people, they get hip replacements and they have surgery to their knee. You may not necessarily have to have surgery.
That's right. I mean, we do surgery. I'm an orthopedic surgeon, but the first thing that we try to do is identify what's the cause, and usually it starts with modifying your lifestyle, as we talked about. It could be your diet, could be your exercise routine, it could be a number of different things with your lifestyle, and then from there we might move into something like medications, first over-the-counter medications. Occasionally we'll do injections. We always try some sort of a therapy program, and we have therapists that work with us that try to find an exercise program that works for you, and then occasionally surgery.
And then lastly, you see all these commercials, or at least I do, where people talk about getting a hip replacement or their knees, and then like the next shot they're like out running again. How likely is that?
Well, we do try to get people back to their activities as quickly as possible. I actually did a patient's knee surgery on Tuesday of this week, and he sent me a video yesterday of walking in the park. We don't recommend running in particular after joint replacement surgery, but other types of activities, that's the whole goal of what we're doing, is trying to get you back to your lifestyle and your activities. So we try to do that quickly.
Got it. Dr. Bozick, thank you for joining us.
Thank you for having it.
All right. Still